Good evening and a very warm welcome to tonight's broadcast with me, Gloria Mutesi. We begin the edition by informing you that today at Urugwiro Village, President Paul Kagame received Jeffrey Feltman, the U.S. envoy, special envoy for the Horn of Africa, who is on a working visit to Rwanda. The Ministry of Health says the country continues to see an increase of COVID-19 infections, with most of them found in confined places without access to fresh air. Take a look. In Chimirongo Bus Park in Gasabo District, Ngabonziza Frank is a driver and is inspecting to see if windows of his car are all open before he sets off. This is something most drivers say they are cautious about, although some passengers don't agree with them. When all windows are closed, it becomes stuffy in the bus, but if they open the windows, it's for everyone's benefit. Some passengers don't mind about that. They even prefer to have the windows closed. We're always arguing with them. It's not easy to keep reminding them the importance of opening the windows and the role it plays in stopping the spread of the virus. Health Minister Dr. Daniel Ngamije says among the things people should do to prevent the spread of the virus is to operate in open places with sufficient fresh air. Research has shown that the virus is airborne and spreads mostly in areas that are confined without proper ventilation. And so, if there's an infected person in such a place, they can infect other people in that same place when they talk or sneeze or cough in the same environment. That's why we should embrace working in open spaces whenever possible. Let's open windows and allow fresh air in our spaces. Dr. Menelas Nheshimana from the COVID-19 task force says that when people are in the same confined area, they share the same contaminated air should one person be infected, and that's how the virus spreads. There are people with COVID-19, but they're unaware of it. For instance, when someone is seated in an office laughing or even singing, they'll contaminate the room. So even though they leave the room and someone else comes into the same room that has poor ventilation, they could contract the virus from breathing in that same environment. For example, the porters or the people that work in markets, they eat from the same place that's confined. We ask that they do some of these activities from outside in an open space, and restaurants should work with them. And even in offices, they should reduce employees as stipulated by the regulations to reduce the risk of infection so that we can beat the pandemic. Dr. Menelas also acknowledges that most people infected currently include porters and people working in confined spaces, in hospitals and in schools. The Ministry of Health says adhering to COVID-19 prevention guidelines is the strongest weapon we have against the virus until at least 60% of the population is vaccinated. Now, staying on COVID-19 related matters, local health workers and officials have given COVID-19 patients in self-isolation in their homes assurances that they are being followed up on that, and any in need of specialized care will be transferred to the hospital. The National Police is in the meantime warning patients against refusing to remain home because they face penalties for refusing to do so. Sessionary with the details.
This is in Gitega sector, Nyarugenge district of Kigali city, and local authorities are checking on COVID-19 patients that are in self-isolation in their homes after testing positive for the virus. I was given this electronic bracelet by policemen 2 days after I tested positive, and they told me that I must wear it everywhere I go. For most self-isolation at home is not terrible because they check on you. It is unfortunate when a person tests positive for it and then continues going about knowingly spreading it. They told me what I must do to protect myself and others, and also provided me with food supplies, so I have no problem. Anyone who does not take this seriously has not seen a person on their deathbed because of this virus. As a young man, I had become accustomed to going about as I please, which of course I cannot do now, and that can be difficult to accept, but it is necessary nevertheless. I can only eat when they bring food for me, and that is hard. Local health workers and officials are given COVID-19 patients in self-isolation in their homes assurances that they are going to be followed up on, and if any is in need of specialized care, they will be transferred to hospital. The National Police, in the meantime, is warning patients against refusing to remain home because they face penalties for refusing to do so. We are closely monitoring such people, such that anyone who does not respect the guidelines given by RBC can 1. Be taken to an isolated treatment center, 2. Face a fine, or 3. Face even more severe penalties under law if they are found to willingly go around spreading the virus. People should respect these measures. There is no need to be stubborn about it. As of Wednesday this week, Rwanda's Ministry of Health had recorded 6,129 active COVID-19 cases, with slightly more than 500 being treated in hospitals and other treatment centers, and the rest in self-isolation in their homes.
Officials in Rwanda's Ministry of Trade and Industry have confirmed that the COVID-19 pandemic has affected regional trade by 244%, costing the country more than $57 million in lost revenue. There is a call for increased trade with EAC member states and for any challenges to be overcome accordingly. Sessionary continues.
The figures were provided during discussions between the ministry's officials and Senate members on Thursday, and it was noted that the pandemic has severely affected regional trade as a whole. Rwandan exports fell from $116 million in 2019 to just $54 million in the following year. Trade between Rwanda and the EAC fell by 8% during the same period, with exports to the bloc falling by as much as 53.2% and imports climbing by 3.7%. I will not dwell on the issue with Uganda because that is a special matter, and as for Tanzania, it is our gateway to getting goods from the port. Because of the COVID-19 pandemic, only essential goods were being let through. Because cross-border trade was severely affected, we turned to other countries like the DRC. Concerning trade with Burundi, the borders remain closed since the pandemic began, so it was also seriously affected. Countries have been affected pertaining to which goods are being let through. The minister also noted that the pandemic has shown the importance of promoting locally produced goods instead of relying on imports. The senators commended measures that have been taken to boost local industries, with 4,067 companies having received up to 56 billion Rwandan francs from the Economic Recovery Fund. But they also pointed out that more needs to be done to boost cross-border trade. Observing trade in our country, we tend to focus on the big items, things like precious stones, coffee and tea, as well as other forms of e-commerce. However, we must not forget informal trade. And so what can we do to boost that as well? We were fortunate to get the big market that the DRC is providing. An honorable minister, when we were speaking to Nyamasheke authorities yesterday concerning youth employment, they told us that they are struggling to meet the demand of such a large market. Such districts should therefore be assisted to increase their local industries, just as other senators pointed out. The senators called for increased trade with EAC member states and for any challenges to be overcome accordingly.
Now, the directors of health centers and private clinics are urging Rwandans to step up their efforts in adhering to COVID-19 preventive measures, saying they are receiving high numbers of people seeking for testing services due to the latest rising figures of infections. Jane Mutoni now reports.
At the Gikondo Health Center, Wantwagirimana Foste had come for a COVID-19 test after being treated under home-based care for the last 14 days, as he had been tested positive at the time.
At the time, I had been tested positive for COVID-19 virus, and I've come back to get tested again to see if I've recovered from it. People should take this virus seriously because it is not selective. Anyone could get infected like I was.
Just like other health centers, Gikondo Health Center provides COVID-19 tests to those who are showing symptoms. According to the deputy director of this health center, Uwamahoro Marceline, the number of those who have been found infected or tested positive has increased drastically these days. Here at the health center, we are noticing a drastic increase in COVID-19 cases, like for example among the people we tested last week for COVID-19 virus. 102 of them were tested positive, and as you've seen, a lot of people come here for testing. At Le Medical Hospital, known as Kwakanimba, as many people had come to get tested for COVID-19 virus, a doctor showed us how they carry out COVID-19 tests. The director of the hospital, Dr. Pierre Celeste Kanimba, says that the number of those that are found infected with COVID-19 virus is rapidly increasing these days.
The numbers are increasing for sure. In the past month, very few people were infected. But recently, we've noticed a drastic increase of those that are infected. We urge people to keep adhering to the COVID-19 preventive measures as they perform their daily activities.
On one hand, some of the people say that the price for a COVID-19 test is still high.
At least if it were like 5,000 Rwandan francs, because this test is not covered by insurances. So we cover it ourselves, and 10,000 is a lot of money.
In various private hospitals and clinics that have been authorized, the rapid test costs 10,000 Rwandan francs, while the PRC test costs $50, which is equivalent to 48,000 Rwandan francs. Those that feel or show symptoms of COVID-19 virus are tested free of charge in health centers. Jane Mutoni reporting for RTV.
Many thanks, Jane Mutoni. Now, in the last 2 years, the Rwandan government has provided 4 billion Rwanda francs through a fund to support researchers conducting research on social development of the community. As Gabi Muvunyi continues, researchers are being called upon to improve the quality of their research to match international standards in order to make it beneficial to the public.
Research on agriculture, renewable energy, air conservation, and the COVID-19 pandemic are some of the research projects supported by the government of Rwanda to ensure a level of quality of life for the residents and will provide solutions to unanswered questions by the public. In a joint discussion with the National Council for Science and Technology, the researchers were urged to conduct quality research with the support of a fund set up by the government of Rwanda to address the financial problems they often face. The head of Department of Research and Innovation Development and Promotion at the National Council for Science and Technology, Dr. Esperance Munganyika, says they have received support. We are happy with the progress the researchers have made. The first project we funded was back in 2019. That was conducted over a period of 2 years and will conclude this year, 2021. This is one we can comment on because we have seen it through. All I can say is everything is in order because all they said to research is all well underway. The Executive Secretary of the National Council for Science and Technology, Dr. Eugene Mutimura, called on the researchers to improve the quality of their research to match international levels in order to make it beneficial to the public as it is supported by a fund set up by the government of Rwanda. This fund has an account in Benin. So whenever we need it, it is accessible. The last year we added approximately 4 million. So the issue here is not money. The problem is the type of research. Secondly, when they have a project that needs to be done right away, that the government can fund, they write to us and our board is able to analyze it and we're able to speed up that process. We urge them to be confident and to work towards international standards. We are here and we're ready to help them. The National Research and Innovation Fund has already funded 91 projects with a grant of close to 4 billion Rwandan francs. The most funded projects are 19 projects related to the research of university professors working with industries that cost approximately 1,690 million, followed by 17 projects related to the COVID-19 pandemic which received funding worth 991 million. Gabi Muvunyi for RTV.
Now, members of the National Consultative Forum of Political Organizations have been engaging in discussions on good governance that were organized by the Rwanda Governance Board. The members have been urged to ensure that sectors that have been found to be struggling are boosted, and examples were given such as security, which is rated at 95.44%, while service delivery has continued to lag at 78.31%, and capacity building through things like proper education at 73.32%. The participants commended such discussions, noting that they help to identify issues that need to be properly addressed. And in other news, month-long judicial activities meant to promote justice have been launched in Rwanda, with officials in the country noting that even though the COVID-19 pandemic has proven to be a challenge, it has not prevented courts from serving the general public and dispensing justice, because the use of technology has ensured that they continue to function. Between March and December last year, 75,012 dossiers were received. 490 cases were tried using video conferencing technology like Skype, while a total of 2,077 rulings were made. Significant improvements have also been made in the confidence people have in the country's judiciary, now at 85.9% approval rating, compared to just 66% back in 2013.
It is your work that make the justice sector in Rwanda what it is. The observation of COVID-19 should not take us away from our primary responsibility of delivering justice, of delivering human rights, of delivering rule of law, of delivering fair and impartial service to our common beneficiaries. Together, again, we will succeed.
We've come to the end of tonight's bulletin. Thank you for the privilege of your time. Enjoy the rest of the programming. God bless you and keep you. And until next time, I'm Gloria Mutesi. Bye for now.